Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress. And in our studio right now, we have John Sbrocco with the Benefits Bureau, located in Morristown, New Jersey. Welcome to you.
Thanks for having me.
Well, you work with a lot of employers trying to figure out the best benefits model for that particular company.
Yes.
What are you hearing from employers on what they are needing now?
You know, they're needing direction on what's going on in the healthcare market. They're faced with these increases every year, 10%, 15% year over year, and they don't know what to do. They don't know how to control their costs and put a stop to it. They get the same story every year and they're getting frustrated. They don't know what to do with the cost, how to absorb it as a company, and they're shifting cost off to employees or have to take it on the chin every year.
Is it companies of all sizes?
Yeah, it's standard across the board. I mean, everybody's facing it. There's no way around it. You just really have to get down into the dirtiness of what the root issue is, and that's the claims cost. How are you managing your claims? And most employers are doing nothing, okay? They're walking in with a blindfold over their face every year at renewal time and expecting a different result. And that's not going to fix the problem.
What will fix the problem?
You know, you really have to look at that claims cost. Where are members utilizing care, okay? If I like to use the example for employers is where are they getting an MRI? If they're using a network like Cigna, an MRI can cost anywhere from $400 at one facility to $6,500 based on where you go, okay? So what we do for our clients is we give them that advocacy tool, a concierge service that lets them know where to go to access that care. So now a member is getting a $400 MRI or $800 MRI versus at the facility where it's $6,500. So on a self-funded health plan, they're saving the company a lot of money, which in essence is the members itself in a self-funded health plan.
Okay, and are employers understanding this, that maybe they have to break the status quo and start shopping around a little bit more wisely?
Yeah, I mean, I think that's the biggest problem is breaking that status quo. It's funny you mention that. That's the topic we all discuss is getting them to stop thinking about the old way of doing things and changing things, looking at things in a different angle, because they just don't get it. It hasn't been communicated to them, and they don't understand that, hey, I'm with Cigna, prices vary from hospital to hospital.
Wow, okay. So is it perhaps they fear it's more work for them to figure out a better way, or are they fearful that maybe it'll end up costing more if they change?
Well, I think they're worried about disruption. I mean, a meeting I had the other day, they said, well, John, I don't want to have to tell members where to go, and I don't want to say you can't go there. I don't want to disrupt my employees. And when I say to them, what's going to be more disruptive? Telling them they have a second opinion to go to get an MRI here, or your premiums are going up 10% next year, and so are your deductibles.
Right, right. What are some of the key things to remember if you're an employer and you do want to shop for a more economical way? What is the first thing they should do?
Well, they need to be working with the right benefits consultant.
And how do they find that? Well,
they got to do the interview process. I mean, a lot of employers shop out every year, and they're out there. You just have to find them. Maybe go on LinkedIn. There's a bunch of us out there, okay? We're not hard to find. But you really have to have that concierge service that brings that price transparency to the forefront for them. They need to know, just like when they're shopping for a car, how much is this car versus that car? You have to give them price transparency. And some of the tools we put in place for our employers allow that. And how do we get members to go there? Maybe we incentivize them. Okay, those are some of the solutions that we bring.
Let me ask you this. We have heard a little bit about maybe consultants like you should be credentialed in this area so that you're really up to speed on what the best models of benefits are. What's your take on that? I mean, how do you keep up with the latest and the greatest of things that are going on, and that you are for sure providing the best and most accurate information possible to the employers?
Well, one would be attending events like this. You know, you're around the best in-class consultants in the industry. You're with some of the best cost containment tools, and you're learning. It's always changing. You have to be learning every day in this business. I spend 2 hours a night reading on the industry. That's me, and that's how I stay up on things.
Right.
You know,
right.
It's that ever-changing. I mean, every day in the news you see something changing, so you really have to be educated.
Right, right. Okay, John Sbrocco, thank you so much.
Thank you.
I've been speaking with John Sbrocco of the Benefits Bureau, and I'm Mabel Jong. Thanks for watching.